St. Charles County epidemiologist Allison Tucker is here. Allison, thanks for joining us today.
Thanks for having me.
One of your responsibilities is to track the growth and the spread of illnesses throughout St. Charles County. How exactly does your staff do that?
We have several surveillance systems that we use to track illnesses. One of the ways we track illnesses is by monitoring reportable conditions. There's a long list of reportable conditions in Missouri, and they include things like influenza, tuberculosis, hepatitis, E. coli, salmonella, just to name a few. So if any hospitals, doctors' offices, schools, laboratories see any of these conditions, they report them to our health department. And then our staff will investigate them. We have two incredible communicable disease nurses who handle the majority of the investigation. So they're collecting information, the demographics, age, address, where they live, gender, but also disease-specific information. So if it's something like salmonella, you'd want to look back a week before they became ill. Where did they travel? What restaurants did they eat at? What foods did they eat? What grocery stores do they normally shop? If they've been around any animals, petting zoos, reptiles. So all that information is collected and put into a database, which then I'm able to pull that data and track the illnesses and also look for any links and exposures. So that's kind of our main way of tracking diseases, but we also use a system called Essence, and that does syndromic surveillance, and I'll explain that a little bit. Essence is web-based, and it's real-time data, and it takes chief complaint data from emergency rooms. So if you were to go to an emergency department and tell them that you have a cough and a fever, that information goes into our system, and it'll take that chief complaint and put it into predefined syndromes for us. So it really just gives us an idea of what's circulating. Besides those two systems, really it's information coming from the public. It's a school that calls in and says that they are seeing rash illness in children, or a mother that says that she had a birthday party for her child and several of the kids are ill. In those two examples, we wouldn't necessarily find out about that through our surveillance systems, but the public calling in and letting us know prompts us to investigate that.
A couple of those illnesses that you just talked about being reportable are food-related. They come from some of the things that we eat or some of the ways that we prepare the food. What are some of the most common food-related illnesses, and what are some of the symptoms for those? There's a number of pathogens that can cause food-related illness. It can be bacterial, viral, viruses, or parasites. Some of the common ones we see, particularly bacteria, are Campylobacter or Salmonella. And they're both diarrheal illnesses, so it would be mainly abdominal cramps, diarrhea, the symptoms that you would have with that. With Campy and Salmonella, they are typically found on raw poultry. So that's why we always stress the importance of making sure that chicken is fully cooked, washing your hands after handling any kind of raw meat, being extra careful with cross-contamination. So that's kind of the common bacterial foodborne illnesses that we would see. But one of the most common foodborne illnesses is actually norovirus. It's a virus. Most people know it as the cruise ship illness or the common stomach bug. It's nausea, vomiting, diarrhea, lasting for a couple days. With norovirus, it's not naturally found in food as the Salmonella and Campy that I just spoke about. It would have to be, in order to get it from food, the food would have to be contaminated. And typically the way that's done is if you have a food handler who's been ill and unknowingly spreads the virus when they're handling the food, and then you consume that. The important thing to know about norovirus is that it's very contagious person to person. So if someone does think they get some type of foodborne illness, we don't always know what the actual cause of that illness is, whether it be the preparation or if it was an actual piece of food, a piece of lettuce or a tomato. What are the steps that your staff goes through to investigate a foodborne illness?
There's several ways that we can find out about a foodborne illness. We could find out about it through our reportable conditions. So if we have an increase in
for instance, E. coli, and we do an investigation and find a link, and we suspect it's foodborne, that could prompt us, of course, to do the foodborne investigation. Or it may be a call from the public. It could be someone that said, I went to a wedding this past weekend and, you know, there's 50 people ill. However we find out about it, we have to act very quickly and gather as much information as possible. And there's a lot of people gathering information at the same time. Our communicable disease staff is going to be doing investigations, so calling people who are ill, finding out their symptoms, exactly what they ate, what they drank, what activities they did. And, you know, at the same time, we'd be wanting to contact a coordinator. So let's use the wedding as an example. If it was a wedding, contact someone who was coordinating the wedding. Find out the menu. Now we have a list of the food items. Get the guest list. If we get the guest list, we can interview more people. We can interview not just those that were sick, but also those that are well, and find out what everyone ate. It helps us in our analysis. At the same time, our environmental people will be going out and doing the restaurant inspection. And if there's any food left over, they can take that food and send it to the laboratory for testing. The laboratory is very important, not just for the food, but also for the people. If it's something like the wedding where we don't know what's causing the illness, it's very important for us to find out the organism. When we know the organism, then we know how it works. So all this information is being collected around the same time. It's being put into a database. There's constantly being analysis done on it, hypothesis testing. We'll change our hypothesis, more testing, getting information out to the public. And if an outbreak turns out to be even larger, we'd be coordinating our efforts here in St. Charles County with the state and the federal level, you know, such as the CDC.
If someone does become ill after eating here in St. Charles County, what would you recommend they do?
If they're feeling really ill, I recommend that they go seek medical attention. If they suspect that it's food, keep the food. Don't throw it out. Keep it in your fridge, because if it is food related, it's possible that we can test that food. But always call us at the health department. You can speak to any of the communicable disease staff or environmental division. And our number at the health department is 636-949-7400, and we'd be happy to help.
Thanks a lot, Allison, for an interesting look at how the health department investigates a foodborne illness.